Surgeons/doctors of Reddit, what's the dumbest thing patients have lied about? Do you smoke cigarettes? No, I quit. When did you quit? This morning. Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes and you can tell they are fed up with the patient's bullshit from their tone. Patient in for routine colonoscopy, asked if solids consumed in 24 hours prior, patient confirms no. In process of procedure, several dozen kernels of corn are discovered in colon and cannot continue. Patient specifically instructed not to consume corn beforehand as this happened prior visit. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke, but they'll tell me they don't right to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive and suddenly surprised Pikachu face. Edit. Lots of folks below rightfully commenting on how indicating you're a smoker increases your insurance premiums. This is true. However, the cost of complications after a surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons so they don't rush into surgeries that end poorly. Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. Penis modification. The case was an elective above-the-waist surgery, and he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his penis and it was split/bifurcated with multiple piercings to look like a cobra. The nurse did not know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected with a possible abscess. Cancelled case, called urology consult for infection/abscess evaluation. 1. Patient says to me, I was outside gardening while naked and I slipped. That's how a massive potato ended up in my ass. Anybody want fries while he is waiting to get it removed? 2. How did you get that stab wound in your abdomen? I put a knife on the kitchen counter and forgot it was there. Then I walked into it. 3. Me, have you had anything to eat or drink today prior to your surgery? Patient no, with a half-eaten candy bar in front of them. Me, are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you to die. Patient, then yes I have, I had half that candy bar. 4. This one guy repeatedly used to come in saying he hadn't shit in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in, who wouldn't be wise to his tricks. 5. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli. Some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said they did that last time. I didn't like it. Do you have any medical problems? No. So no diabetes? No diabetes. What medications are you taking? Metformin. For my diabetes. I facepalm every time. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't, which is the vast majority. There's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore, but mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. And in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time they book an appointment only to talk about recent trivialities, which makes them clearly better, although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem. and one that no one should be bound to live with. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave report to the MD, and when I walked back in with the doctor she looked at me and said, "I didn't think you'd be coming back in the room," and then proceeded to confess that she'd been cheating on her husband and thought she had herpes. She did not have herpes. It's not so much a patient lie as it is me being dumb, inexperienced and uncomfortable asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran, and I was admitting him for rectal bleeding. He was in the age where it more than likely colon cancer, so I didn't think it was necessary to ask a sexual history. Folks at this particular establishment were known to at times be homophobic, and I had been yelled at by patients previously for asking, "Do you have sex with men, women or both?" It ate away at my conscience, though, so I went back and absurdly nervously and asked him. He answered, "Son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights, but I wasn't sure how it would go over to admit it." That's when the bleeding started. It was a very important lesson for me. Woman comes to EMERG with complaints of vaginal discharge and discomfort. Pelvic exam initially reveals significant yeast infection, but there appears to be a foreign body in her vagina. Is there something stuck inside? No, I don't know what's in there. Speculum examination reveals a very soft mandarin orange, peel still on. Oh, that. We heard it would improve our fertility. You can't make this shit up. I had a guy insist that someone else put cocaine and heroin in his urine, even after I tried to move on with the conversation. One of my favorite things I wrote my first year out of medical school. Please note, patient has stated multiple times that he wants to leave and would leave AMA, against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first, and if he tolerated it well, would transition to regular foods. However, PT ordered Chinese food delivery instead. Then, patient was complaining of a headache. Was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told not to give patient the goody powder. She supposedly did not. For context, the patient had a catastrophic GI bleed from taking too much aspirin. My dad neglected to mention he had no teeth. Since 1976. We found out in the ICU. In 2022. Patient, I haven't drank alcohol in months. Patient's family, it's true I've been with her the whole time. Me, ma'am, your alcohol level is 325. Patient, impossible. I would never lie to you. My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts, from light bulbs to hairbrushes to a golf shoe. And at first it's hilarious. Then after a year or so it's not funny because you've seen way too many distended buttholes. Then after a decade or so it starts to get funny again because you think you've seen everything, and then one day a 45-year-old man is driven to the hospital by his wife and he has a golf shoe up his ass, and he told his wife that he and the boys were golfing and he slipped in the locker room and it got rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse, patient says he can't move legs following a lumbar puncture, spinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain and he asks for intravenous narcotics, Dilaudid. I tell him no because this story makes no sense. By God, it was a miracle, I tell you, when this man walked himself right out of the hospital after I refused the fourth narcotics. Also, the MRI was normal. Did cocaine the night before elective surgery, didn't disclose at pre-op. Cardiac arrest. Beta blockers and cocaine don't mix well. Adherence to medical treatment when I have literally pulled their pharmacy records and know they haven't picked up their medications in over a year.